So my name is Charity. I am here with
Emily.
With Dr. Derek's office. Emily, I'm just going to go through a few questions with you, if you don't mind.
Yeah, no problem.
What is your current position and how long have you been in this profession?
I'm a dental hygienist and I've been practicing for 2 years.
Okay. How did you land this position?
This particular job, I had just moved to the area and I was doing a lot of subbing. I had just graduated and I was kind of feeling myself out, trying to figure out what kind of office I wanted to be in.
Okay.
And just so happened they needed somebody to fill in, and that person wasn't able to return, and so I got the job. Yeah.
Excellent. What do you enjoy most about your job?
I have always been a people person, so it really fulfills me to help people. And you know, sometimes I'll have a patient, you know, really not listen to what I'm saying, but I know that I'm getting my point across, and I hope that I'm helping them. But there are other people that I know listen to me, and I see an improvement in their oral health, it feels great.
Yes, it does. Do you work as a team, or are you more independent in this position?
Well, the hygiene position is an independent type position. You know, we work hand in hand with the doctor, so there's not, you know, a lot of supervision going on there. We certainly work together, and yes, he's my boss. And we work as a team with the assistants in the office and with the other hygienists too. We're always helping each other out.
Okay.
Yeah, we're always helping each other out. Sometimes we run behind with patients. We're always helping each other with our instruments. So it does take teamwork. I think no matter what you do.
Exactly, I agree.
But it is kind of an independent position.
All right. And how does this style impact your work?
I really love it. I flourish with it because I spent 20 years in retail management, so I'm kind of used to, you know, having a little bit of control over what I'm doing. So there's really not a whole lot I don't like about my profession.
Okay. So then that brings me to, what do you like least about your job?
That would be those patients that just don't listen. I have a teenager, and you know, I've tried crying with him. I've tried getting mad at him, and he just comes in super gingivitis everywhere, and it really does affect me. I really want that kid to get better. So that's probably the biggest thing I would say is a negative. Those people you can't get through.
And you know, you can try so hard, and sometimes they're just, you know, don't care.
It's a profession of caring, so if you don't know how to turn it off, it can really.
I agree. What was your major in college?
Well, I started originally in college in 1990. A little older. And
you don't look like it.
I was just going towards a general degree, and I was working at a jewelry store, and they made me a manager. So I actually stopped school at that point. And then when I went back just a couple of years ago, hygiene is what I was going after. So you don't have to finish an AA. So I just worked towards my prerequisites, and then
that's
I did the
exactly
hygiene program.
what I'm in the process of doing right now.
But I am going to finish up the 2 math classes I need for my AA so that I can get my bachelor in hygiene.
Hey, that's awesome. Congratulations. So please describe your career path to this current job, which
a lot of that retail, which, you know, one of the most surprising things to me once I did inner hygiene school, because I did a lot of jewelry repair, and I've always worked with my hands, so I had those skills. And then, of course, all kinds of people skills. You know, I think, and that's a really important thing to have, too, as a hygienist. You've got all these different personalities coming in and sitting down, and you've got to find a way of connecting with them, especially if it's your first time meeting them. You got to make that connection fast.
Exactly, because then
build trust.
Completely.
So all of that helped a lot.
Yeah, excellent. Well, Emily, I appreciate it. It was nice talking to you today. And that concludes today's interview.